Good afternoon, everybody. This is Dr. Gigi. I am a pediatric physical therapist and oral motor specialist, and I am trying to lean in so you don't see the stain on my shirt because life and I'm human. So welcome. I would love to know who is tuning in and where you're all from. So just write it down so that I could see where you guys are from. And of course, if you have any questions that you want specifically answered, go ahead and put them in the chat, and we will do our best to answer them. Hi, Megan. I see Megan from Pennsylvania. She's another power PT that helps babies around. So many of you are popping on here. Hello, welcome. So let's dive right into stuff. I want to talk about what good oral health is and why it's important for a child and a baby to have that good oral health, what that means, and how we can help to achieve it. Basically, the goal of any of the exercises that we do is always to improve the tongue function, because the tongue is really what drives that good oral movement and the good rest posture of the tongue and all of those important things. And so we want to make sure that the tongue moves well. So we want it to have good mobility. We want it to have good strength, because the strength of it is what allows it to move in different ways against gravity and that kind of thing, in order to breastfeed or bottle feed or feed in any kind of way, whether it's solids or anything like that. It's also very important to recognize when the tongue is weak, and so we're going to talk a little bit about that. One of the big things about recognizing that the tongue might be weak or not have the range of motion that it needs in order to properly feed is that clicking noise. So whenever you have a clicking, it generally means that the tongue is popping off of whatever it's supposed to be attached to, whether it's the teat of a bottle or the nipple of mama, food or whatever. So you're going to notice that click noise is the tongue popping off. Now the tongue pops off because it's either weak and it can't stay on, it can't maintain that suction, or it's being pulled down in the opposite direction. So if there's a tie and the tongue can't elevate correctly, it's being kind of pulled down in that other direction. So it'll be pulled down and off like that. So I've got my little friend here. He's a big mouth compared to me. But I just want to show you the tongue moves in a bunch of different ways. There's what we call extension, so sticking the tongue out, okay? And a lot of doctors will say that a baby can stick their tongue out and they don't have a tongue tie, but that actually is not the case at all. And in fact, I would even dare say that you don't need to extend your tongue to eat. So it's not an indicator of anything, to be honest. So they need to be able to extend it out. Okay, they need to be able to move it side to side. We call that lateralization. So side to side. Okay, we need it to move up to touch the roof of the mouth. Okay, so not just the tip of the tongue, but the entire tongue should be able to be up and against the palate. Okay, we call that a cave. And the most important thing, I think, is that the tongue needs to be able to cup. That nice C curve, okay, like this. My guy needs a little bit of help. So a nice cup with the elevation is what's going to really get a baby latched well and transferring well. Okay, so that elevation, cupping, and just having that mobility to move up, forward and back, and side to side. Okay, so as a physical therapist, we look at what the basic movements are. Working on those basic movements is what allows us to then combine it into what we call a functional movement. So functional movements basically are things that allow us to live day-to-day life. So for the mouth and the tongue, a functional movement would be eating, breathing, okay, because the tongue needs to be in a certain way to breathe, to eat, and to sleep. When they are sleeping, we want that tongue resting up on the palate. So if you just sort of think about where your tongue is now as you're listening to me, it should be up, okay? So the tip of your tongue should be right behind those top two teeth. okay, forming that nice suction. Who feels like their tongue is in that spot? Give me a little thumbs up or a heart or something. And whose tongue is down on the bottom of their mouth. So you don't want the tongue to be hanging out down here. You want lips nicely, just gently closed, tongue up at the palate, okay, and breathing through your nose. Why that's important is because the tongue resting on the roof of the mouth is actually what forms the palate. The palate is not only the roof of the mouth, but the floor of the nose. And so if you can picture, it should be relatively flat, nice and broad, and that allows air, a lot of space to enter through the nose. So when you take that deep breath in, there's a lot of space for that air to enter and go into the lungs. Okay, it's really important to be breathing correctly, because when you breathe through the mouth versus the nose has little hairs, and those hairs are called cilia, and what they do is actually purify the air as it goes into the lungs. When they breathe through the mouth, that doesn't happen, and so you are just more prone to infection and a lot of like the stuff that's in the air going right down into the adenoids, the tonsils, and all of that stuff, and can cause infection. So we want proper breathing through the nose for several reasons: to prevent those infections and to make sure that the tongue is up on the palate to allow that space to be optimized. All right. Let's jump into why exercises are important. Now, I want to take a minute to just delineate the difference between oral exercises that a therapist might give you versus what the doctor or the release provider is going to be giving you after a tongue-tie release. So what the provider is giving you is what we call active wound management. And basically what that is them showing you stretches in order to keep the tongue healing in the right way. Okay, those are different than the exercises that a therapist, a myofunctional therapist, a speech therapist, a PT, and OT might give you to help with the function. Okay, so remember, function is eating, feeding, sleeping. The wound care exercises are to allow that tongue to heal properly in the way that they divided it so that it remains in that right position. So it's important to do some of the wound care, of course, as your dentist or whoever it is that's releasing the tie has instructed you. I have found recently that the doctors are actually being more proactive in giving some exercises to work on the tongue movement and function, which is amazing. The thing about that is that there's general exercises, but then really you should get some custom-made exercises for your baby. So maybe your child is having trouble opening wide. Maybe your child is having trouble with clicking. Maybe you're having pain and your nipple is coming out deformed. So each one of these things has different exercises that you would do. And so you really need to customize and get like a unique set of exercises in order to address whatever it is that your baby is having issues with. Otherwise, you're doing like 20 exercises and you don't really know which ones are benefiting your baby and which ones are a waste of time because your baby doesn't need it. One of my favorite things to do is to show exercises with teethers. So teethers are like a fun, gentle, low stress, happy way to get the baby's tongue moving, the mouth opening bigger, the cheeks, like all the exercising muscles that are for feeding to work, like I said, in a calm, safe environment where the baby can control it. Okay, because a lot of times we're sticking our hands in the baby's mouth and they don't like it. And so using a teether is just allowing them to get some exercises in a way that is safe, gentle, in their perception. And so I love a bunch of different things. I have my little display here. And let me show you. The first one that I always use is the O-ball. So the O-ball is amazing because it allows the mouth, like I said, to open big. Okay, it allows the tongue to move as it goes around and in and around. So something about this thing naturally makes the tongue move. I don't know why, but it just does. Okay, it's my little thing. I also love, because I'm a pediatric PT, that it allows a baby to grasp, okay, and it allows them to bring it into their mouth. Those are some basic developmental things that we look for in children, in infants, as they're growing. So if a baby is, I would say, under 12 weeks, I won't expect them to grasp it and put it in their mouth. But at that 3-month mark and over, I would like to see them grasp it, put it towards their mouth, see that tongue, and open nice and big. So this is a great toy to elicit all of those different things. I also, if you're not into the plastic, then this guy kind of does the same thing. And I love this for its pretty shape, the gentle noise that it makes. You can hear that it's very calming and soothing, and it accomplishes the same thing. It allows them to open big, stick their tongue out, move it all around, and also grasp and bring to mouth. Very good toy. Some of my favorite teethers, and they're actually the ones that sponsored today's live, is actually made by InnoBaby. So I've been recommending these teethers for a super long time, and they've come out with all different ones as the time has gone. So I used to always recommend the Star Teether. I love that it has a lot of different textures. So, you know, it's all different little textures you can see, but they're super gentle too. So the baby's gonna get that input and that feeling and create a little bit of curiosity to allow their tongue to move. So they're gonna put their tongue on it, they're gonna feel it, they're gonna want it again, okay? And I feel like both of these sides serve a good purpose. So if it's a baby that maybe has a sensitive gag reflex, then we just start with one little tip in their mouth and see what happens, okay? You let them move it with their tongue, push it up into that palate, right? If they're good, then we try to give them 2 in there, okay? And again, work a little bit on that gag reflex, bringing their tongue up and around. Every time a child has to lift their tongue up to the palate, that's working on strength, okay? And anything against gravity is what we call working on our strength. And so you'll see that an experienced therapist is gonna practice this in a bunch of different positions. So the baby could be on their back, the baby could be on their side, and on their belly. And ultimately you're working different strength and different muscles in all of those different positions to really get that tongue movement and strength back. I love this little flower teether that they have as well. Again, anything that creates a little interesting noise is going to garner curiosity from your baby and have them want to play with it. And so you will really see a bunch of different tongue movements with this exercise in their mouth. And I love handing these to babies when they're in the car seat. Like if you're going somewhere, you give it to the baby, and that way they're not just sitting there. They're actually, you know, working and moving their tongue and biting and chewing on things. And Jennifer says, I bought those and she is really much better sticking her tongue out and movements. Thank you so much for that. So yeah, these are great tools to use. Like I said, it's a happy, calm, low stress environment where your baby can be exercising without you having to stick your hands in their mouth, and you're still getting the benefit. This fruit teether, they have a whole bunch of different ones. There's an apple, there's grapes, there's strawberries, and an orange. So it doesn't really matter. What is important to me is the shape and the width of it, okay? So I want the baby opening wide to be able to fit this into their mouth, because a lot of babies, as you know, they're like, and they don't open, and what we really need for a good deep latch is a big open mouth for them to be able to stick their tongue down and out and latch. So you need that wide mouth. So I like these for babies who don't necessarily like to open their mouth wide. So this is a good practice to be able to open wide. As the baby gets a little bit older and can hold things on their own, I'm going to show you a couple of different ones. This one is the Komotomo teether. Again, you see that it has a little bit of texture on the edges. Okay, and that texture again allows for curiosity, allows them to put it back into the sides of their mouth. As a baby ages and gets more towards readiness for eating solids, we really want to see that they have good jaw stability, meaning that they can hold their jaw open and their tongue can move and the muscles around it can work. And so you really need them working on biting. So anything that has sort of a long stick type thing is what we want to give the older babies So they stick it back into this, like almost towards those molars. Of course, on me, it's not that big, but on a baby, it will go all the way to the back, and you want to see them biting on that. This one is awesome too, because again, it's super textured, as you could see. This is the Zoli. So you put it in the back and it allows them to bite, 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 bite. I also drive it up to the palate sometimes to kind of get the tongue to follow, and for them to feel different things on the palate, because some of those babies whose tongue has never reached the palate have very sensitive gag reflexes. So those are really important exercises to decrease the gag reflex and get the tongue up there towards the palate. I'm just scrolling through, seeing if there's any other comments. All right, these P and Q again are great little tools, and they are so these are great tools to use. Same idea. What these are have a little bit of resistance on them, so when they're biting, chew, 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 you're gonna see that they are really using their jaw and creating that jaw stability that we're looking for. Again, these are really good to use in the car seat when they're just playing on the floor, allowing them that flexibility to put them in their mouth and do their thing. And then my last couple that I actually love are anything even longer. So look at this texture, okay? So there's hearts, and then there's those little bumps. And it's fairly large, so this wouldn't be appropriate for a child that's, let's say, under 6 months. So with a baby that's over that, I like to give it to them because they can put it way back, they can reach all different parts, make sure that there's no sensitivity, that they're biting and getting that jaw stability, and that their tongue is following and moving it all over the place. And then these are chewy tubes. It's a therapy tool, again, that has a lot of resistance, so the baby can bite, 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 and really work on their strength. So those are all of my fun little toys that I use for helping them exercise. Definitely let me know if you have questions. I'm gonna scroll back through and read, and then I know I got some over the box that I posted that I will try to answer. Hi from Michigan. Hi Alicia, you're in Michigan. Paula, you're from Wayne and an Maine, IBCLC. Welcome. Oh, Jennifer sees one of my amazing therapists, Shelly. That's amazing news. She's awesome. She's amazing. Let's see. So many of you here. I had a 22-weeker who came home on a feeding tube, transferred to bottles, and now is exclusively breastfeeding. Alicia, wow, what a story. That's really crazy. 22 weeks is insane. Your baby's a miracle baby, and congratulations. That's such great news. I wish that was the case for everybody. Julie Ryden wrote, so informative. I've learned so much from you. Thank you. Well, thank you. Alicia Weems says she clicks a little with breastfeeding, but her latch doesn't hurt and she's gaining properly and moving great milk. So as a therapist, we look at, like I said, function. So if your baby is eating well and they're not compensating too much where it's causing pain or any issues, then we just let it be for now. You kind of kick the can down the road as long as you feel like they are breathing well, sleeping well, and doing all of those things. Then we're not going to unnecessarily do a surgical procedure if there's no reason for it. But that doesn't necessarily mean that it's not going to cause trouble later, because it may. So we just keep an eye on it and we see how things go. I always recommend that if you do feel like your baby has a lip or a tongue tie, that you do get some of these toys and just have them play, because it's always best to maximize what they have and keep things moving in that positive direction. It's just like, you do core exercises to prevent that back pain. So, you want to be nice and strong so that if you do ever get injured or whatever, you're nice and protected. My baby has ankylosing and it got cut off, so I don't know what you were trying to say there, so go ahead and retype what you were trying to say. My 3-month daughter had a lip and tongue tie surgery 3 weeks ago, and now she's having PT with you guys, and she is much better with breastfeeding and bottle, thanks to you guys. Well, thank you for trusting us. I'm so happy that we were able to help you. There are so many people that don't necessarily have access, and that's why we provide this information on here. I have a toys and tools link on my Instagram. It's a highlight where you can access these different toys, hopefully, as well as ideas for exercises. Let's see. Let me scroll. Never ending. Christina Elena wrote, waiting for our appointment for my 4-year-old daughter to get Vivos and talk about release and myo today. Your account has opened my eyes to so much and the importance of fixing her mouth. Well, thank you so much. Raising awareness is so important. And a 4-year-old is out of my specialty realm, but working with a myofunctional therapist is a great idea to be proactive and figure out exactly what needs to be done. I personally didn't realize that my son had a tongue tie until I started learning about this, and he was released here in New York by Dr. Siegel at 9 years old. So it's not really ever too late. So it's always, if it's causing an issue, and for him, he was definitely sleeping with his mouth open, was getting a lot of headaches, and was in speech therapy for many years. And none of us knew he had a tongue tie because I didn't know how to check. But once I started learning about it, I went, oh my gosh, it all makes sense. The clicking, the reflux, the spitting up, it all made sense to me, the delays in speech. And now he's 12, thriving, doing amazing. So it's never too late is what I want to say. My son was 9 when he had it done. Scroll. I wish there was like music we could play in the background. Do. Lactation Solutions of Princeton. She's asking if I use chewy tubes. And so this is definitely one of the chewy tubes that we talked about. These are made by Chewy Tubes as well. They're great and they do help to strengthen. So the answer is yes, I do, and I recommend them. All right, Hannah says, I have the master class and have implemented a lot. I've seen great changes. What do I need to focus on for babies that throw up a lot? So the master class, for you that don't know, is a webinar that I created for people who don't have access to physical therapists or speech or myofunctional in areas. I get calls from all over the globe or from rural areas that don't have access. And so I created a webinar where I show you guys some general exercises to do to decrease some tension, some tightness, to get the tongue moving. And I also have a suck training webinar. All of those you can find on my page, and they seem to work really well for people, and I'm so glad that they have that option. For babies that throw up a lot, I think that it's important to take a deep dive into understanding the why, and then go from there. There's so many things that it can be. Of course, throw up needs to be determined. Is it a little bit of spit up? Is it full-on vomiting? Is there allergies? There's a lot that needs to be looked at, so I do recommend that you work with somebody to help you identify what those things would be. My baby's tongue clicks when nursing. Does nipple size cause less of a latch? So the size of the nipple should not really determine whether or not a baby clicks. Sometimes adjusting their position may help to get rid of that click if it is a thing, but I definitely recommend that you reach out to a lactation consultant. And I have on my page, again, something called Find Help Highlights, and that will just allow you to find someone in your area that is trained in this kind of thing and can help you answer those questions about why your baby is clicking, give you some tips to try and improve it, and then refer you on if there is something else that's going on. Marianne wrote, do these help with the clicking sound? I'm assuming she's asking about the toys. And so the teether toys may help if the tongue is able to get up there and stay up there. The toys will help to get some of that mobility and strength. And so in theory, they should help. But if there is other reasons, like a tongue tie that's really preventing the tongue from lifting, then they may not completely resolve the issues. Tiny Touch JC, hi there. She wrote she's new IBCLC. Welcome, so happy to have you. Shaber Downtown says hi. When should we worry about buccal ties? 20 weeks. Lip and tongue tie released at 4 weeks. Feeding at the bottle and breast efficiently. So there's actually, Natalie, very little information out there about buccal ties. I find even the release providers are divided. Some of them think that they do have an impact and some feel like they don't. I'm kind of in the same boat. I think that sometimes I felt the ties in the buccal areas, but the baby has no issues. Sometimes they don't have them and they still can't open wide. And so it's really on the fence. I wouldn't make any bold blank statements about them in particular. I would say work on helping the baby open wider, relaxing those cheek muscles, and then seeing how that helps. Are you guys having trouble with the audio? I don't even know when that was written. Hopefully it wasn't too long ago. Can you guys hear me? Give me like a thumbs up or a heart if you can hear what I'm saying. Are the toys only for babies with tongue ties? My 6-month-old doesn't have a lip or tongue tie, but I want her to have great oral strength. What a great question. I love you. So you're absolutely right. Toys are toys, and it's always good to just maximize strength, get your baby moving their tongue better, get them chewing to make their jaw more stable and ready. So yeah, absolutely. These are just great toys that are good for oral development and health in general. So yeah, grab them. Like I said, give them to your baby in the car seat or when they're playing on the floor or whatever the case is, to just have them maximize their strength and mobility. Great question. Audio is good. Awesome. How soon can we expect improvement with suction, clicking, tightness? Good question. So it really depends. Unfortunately, I never have just a quick answer. What I was taught in physical therapy school is that change happens within 4 to 6 weeks of doing a new exercise. So think of like when you're just starting at the gym and you're doing bicep curls. After that 4 to 6 week mark, you're ready to make it a little stronger because that's when the change happens. So I would say in infants, generally speaking, it may happen a little bit quicker, but that 4 to 6 week range seems to be sort of what's going on in therapy too. So kids come in here, they need therapy for 4 to 6 weeks, and then they're really showing a lot of good change and different signs of improvement. If baby is still only feeding off of the letdown after the release, is this when this class helps? Sorry, Mika Adair, I don't really understand your question. But if a baby is feeding off of a letdown after the release, I highly suggest that you get a little bit of therapy. So have somebody that is trained, that knows what they're doing, look at the baby, how they're feeding, compensations, and someone who understands all of that and can help your baby figure this all out. The functional training exercises are just as important as the release provider's wound care exercises. So the wound care exercises are the ones that are there to make sure that the tongue is healing properly, but the functional exercises work on the tongue's mobility and the strength, but also that brain-body connection. So understanding that when there's a nipple, the tongue has to and do its little magic in order to suction and pull milk from the breast or bottle. And so the suck training is going to be helpful, I think, if your baby is still having trouble feeding efficiently at all times. At what age should you introduce toys? Great question. So I personally in therapy start showing babies toys around 6-8 weeks. Again, don't expect that they're going to be able to hold them and bring them to their mouth at that age. They're just not developmentally ready for that. But around that 12-week mark is where they will start bringing them to their mouth on their own, and then starting to kind of like grasp them and put them in their mouth. But you can pretty much introduce these toys to any child that's like 6 weeks or older. Just know that you're going to have to be holding it for them. Cool. So let me see if the questions popped up. I started noticing the baby's tongue not resting on the palate. How can I improve the strength? So you got to work on that tongue coming up towards the palate. If the baby's tongue is not there, you got to bring it up there. Give some of these exercises a try, and hopefully, and some of the toys, and hopefully that will help. Natalie Avery, loved your suck training webinar, post-release. SLP helicopter mom here, and love all the info you relay. I love when other therapists get to try out some of this stuff, because you've probably known about this way longer than I have, and it's so great to hear that my stuff is helping you guys out. I may put a little bit of a discount for you guys to buy this today, my suck training webinar, so that everyone has access to it with the toys as well. Where'd those questions go? Here we go. Specific ones to help with an overactive gag. We talked about that. Our body worker didn't give us any exercises. I mean, if you're going to someone and they're not giving you exercises to help you, I'll let you fill in the blanks with that one. How fast will you start seeing progress? We talked about that already, 4 to 6 weeks. How to increase muscle tone in the mouth after revision. Baby's mouth is always open and tongue is out. So muscle tone is something that we can't totally fully change, but you can improve the mobility of the tongue, the strength of the tongue and the mouth muscles. So I would say start doing some of these exercises and really just continue to work on getting these things done. Are there any exercises to address an uncoordinated swallow pattern with extra breaths? Good question. I really suggest working with somebody that's trained, that understands that. Trying to do that on your own as a mom is so overwhelming. It's just so hard to understand and figure out and know. And so getting that help is really so key in your success. And you know, someone said this on here earlier, if you were listening, but it was a mom who reached out to us. And just in a few short sessions, you start to see improvement. So when you get the help of somebody who knows what they're doing, you will see a lot of improvement. Trish Lawson, I send all my clients with tension and TOTS issues to check out your work. Love you, and can we just talk about your eyes? Fun fact, well, thank you, Trisha. You're so sweet, and I'm so grateful that you send people to come check this out, because that's exactly why I created this page. But here, fun fact, my eyes are 2 different colored. You see that? One's green, one's hazel. Can teething impact resting tongue posture? Yeah, I mean, I would say that definitely, because they're constantly gnawing on things and the saliva is kind of pooling and falling out. I don't think it necessarily impacts it negatively long term, but you may see that they're always got their mouth open and they're always drooling. So just be aware. I mean, as long as nothing else has fully changed, I think that that's all right. All right, guys, any other questions? Don't forget to check out the giveaway that InnoBaby has so graciously offered to give you guys some really cool stuff. So I will repost it again today, but definitely make sure that you enter. They are a fabulous, fabulous company. I can't say enough good things about them. They're women-owned and just like really don't skimp on anything. They use the best supplies. They have such great open communication, and I just love them, love them, love them. Okay, one last question. How much does baby seeing mom's mouth move influence them? I think I have a tongue tie, but I don't think she does. I had jaw and sinus surgery and wish I knew about this before. So super, super interesting, like geeky fact is something called mirror neurons. You can look them up. But basically it's exactly what you just said, that a baby will learn to mimic and their neurons grow and develop just by watching you. So move your tongue, stick it out. La 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 la, ma 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 ma, da 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 da. All those different motions and movements, they're gonna watch and learn from you. So don't worry about what you can and can't do. Just make those motions and sounds with your baby and have fun with it. Okay, one more question. With suck training, does bottle feeding improve faster than breastfeeding? How to best support breastfeeding? Megan, that's a really tough question to answer because I don't know you or your baby or what the issues are. I would say, again, work with a knowledgeable lactation consultant or, speech or OT or PT, because they can really help address what the issues are. Sucking looks a little bit different on a breast versus a bottle, and so I don't know where the issues are or whatever, but some kids have a really hard time on a bottle, some kids have a really hard time on the breast. So there's no blanket statement here, but definitely reach out for help. And if you need help finding somebody, send me a DM. I'm more than happy to connect you with some great IBCLCs. All right, guys, I think we're going to wrap up. Thank you so much for attending. I love doing these. Feel free to send me a DM. Feel free to share this with some of your mom friends that you think may benefit. And happy shopping. Bye-bye.